All right, take two. First time I recorded this whole thing, it didn't work, so we're doing this again. So this is the kin or kinesiology 102 lesson, joint type and function, bony landmarks, the introduction to bones. This all can be found in your Trail Guide to the Body 6th edition book. That is the bluish spiral bound book that you have that shows all the muscles, bones, joints, ligaments, all that stuff. Um, so let's first start with the skeletal system itself. If you look at this picture here on the left side, you have kind of grayed in or purpled in, I'm not exactly sure what color that is, the axial skeleton. So that axial skeleton consists of the cranium up on top, so right around where your brain is housed. The vertebral column, so this running up and down, so that's your vertebrae, which houses the spinal cord. You also have your ribs on either side. Okay, that houses a lot of those internal organs and keeps them safe. And the sternum, which is right up in front, also called the breastbone, and the hyoid bone, which is actually upper neck area, just kind of behind the jaw. It goes up and down a little bit and protrudes a little bit. Is not the Adam's apple, but is something a little bit north of that, basically. So that is the axial skeleton. And we call it axial because it is sort of the axis of the body, and everything else kind of rotates or moves around that axis. And then we have the appendicular skeleton on the right hand side. So the appendicular, some people call it the appendicular skeleton. Think appendicular or appendage, appendicular appendage. So basically everything that comes off of the axial skeleton. So we have our scapula and our arms and lower arms. We have the hip girdle and then the legs that come off of that as well. That would be our appendicular skeleton. Um, Moving along, uh, each area where those bones come together forms a joint. And there's lots of different types of joints that these bones form when they butt up against each other. It's also called articulation, where the bones come together. They're articulating bones or joints. We'll start with three classes of joints, and then you'll see here in a second they can also be classified a different way. But to start, the three classes of joints here, we have either fibrous, cartilaginous, or synovial. So, fibrous joints, these would be the ones right down here. Fibrous ones are pretty immovable. They're connected by thick fibrous bones, and they're found in areas that require a lot of strength and stability. They just don't want to move. So, an example would be like the sutures in the skull here. So, all those thin little cracks between the different segments of the skull, they provide a lot of stability. They do still move, but they're highly immovable. You won't be able to see them move at all. Um, Also, in the teeth here, too, we don't want the teeth kind of moving around in our mouth and providing instability while we chew on things. And so that would be another area where it would be a fibrous joint as well. The tooth is a bone connected inside the jawbone. Then we have our cartilaginous joints. Cartilaginous joints are bones united by some sort of fibrocartilage or hyaline cartilage. And so when we see the white on the end of different bones, those are cartilaginous bones. In between each one of these vertebrae is a disc, and that disc is that cartilaginous substance. Another area, the pubic symphysis, where the pubic bone kind of butts up together so that everything kind of rotate and move in and out a little bit. There's one right there as well. And you'll see areas where all of these joints are here in another slide here in a moment. And then lastly, we have our synovial joints. These are highly movable. And because they're highly movable, they need to be lubricated. Just like any highly movable joint or gear or anything like that on a machine, it has to be lubricated, or else it's one hard substance or one hard uh, piece of structure on another that's just going to rub together, create friction and heat and everything. So with synovial joints, they all have synovial fluid that lubricates that joint, and that synovial fluid tends to be in a capsule. And so that's called the synovial joint capsule, and there are membranes inside. So here you also see some cartilage inside between the two bones, but on the outside to help lubricate that cartilaginous area, there will be joint fluid. So those are the most movable and flexible or common type of joint in the body. Okay, so you'll see these in areas like the elbows and the knees and the hips and things like that. So that's a synovial joint. Now you'll see these are also classified a different way on the next slide. And so sort of interchangeable words here, and we'll see how here. So remember fibrous, cartilaginous, and synovial. And here we see again fibrous, cartilaginous, and synovial, but they're also going to be called something else. So our fibrous are also going to be called synarthrotic. So one goes with this one here. So those sutures in the skull again. So these are synarthrotic. So when you think synarthrotic, amphiarthrotic, and diarthrotic or diarthrotic, one way to remember synarthrotic is when you sin, you get caught by the cops and they stop you from doing anything else. So they don't allow you to move anymore. So synarthrotic, no sinning over here because you'll be put in handcuffs and stopped from your movement. So those are fibrous joints. Same kind of interchangeable terms. You can use either one. Amphiarthrotic is going to be something that allows just a little bit of movement. So right here again, here is a vertebrae, here's a vertebrae, here's a disc in between that allows some degree of movement. Not a ton, but you can maybe flex laterally, you can extend and flex forward or something like that, maybe a little bit of rotation. That's amphiarthrotic. So cartilaginous joints are also called amphiarthrotic joints sometimes. And then our last one, synovial joints. This allows that full movement. Those are also called diarthrotic or diarthrotic joints at times. So again, full movement, the elbows, the hips, the knee joints, things like that. Full movement. Okay, they have a synovial membrane within the synovial capsule, and it gets lubricated. Okay. No. So we had the classification systems that kind of, we had three classifications and we had a different way to classify those joints. These all are movements that are allowed with synovial joints or diarthrotic joints. Okay, these are the types of movement that you might see. Okay, so these aren't classifications of the joints, these are classifications of the movements. So, and these come from synovial joints, remember, or diarthrotic, freely movable types of joints. So, what we have here in the upper left, I think it's first in your notes, is your ball and socket joint. This is going to be the most movable type of joint because it moves in every plane. And if you remember earlier, we talked about planes of movement where we have our frontal plane that divides the front and back half of our body. So, doing things like jumping jacks is on the frontal plane. We have our transverse plane, which divides into upper and lower halves, which allows rotation of our body. So maybe swinging a tennis racket and rotating to the left or to the right. And we have our sagittal plane that divides our body into right and left halves. So if we move on the sagittal plane, it's like we're running maybe, and our arms are coming up and back, and our hands are moving in that sagittal plane. So our ball and socket allows movement in all of those different planes. And it's the most movable. So you have a spherical surface, and that goes into a concave or a dish-shaped surface. Okay, so that would be the ball and socket joint. Then you have what's next in your notes? The hinge joints. The hinge joints basically move like a hinge in a door. And so you have something that's a little bit more round, and then you have something else that it fits into and basically just allows movement forward and backward, or hinging in and out, basically. And so this would be something like the elbow, where we flex and extend the elbow joint. Our knee is also a hinge joint where it flexes and extends. It's also modified hinge, and so it kind of shifts a little bit more than the elbow does, but that's a hinge joint as well. It only allows flexion and extension, just like a door. Then we have our pivot joints in the upper right here. Okay, our pivot ones basically just allow some sort of rotation of one surface around another. So those two surfaces do butt up against each other, but it kind of allows rotation around it so it can kind of glide around that surface a little bit. So a pivot joint is going to be like the neck and the head. So we have our atlas, which is our first cervical vertebrae all the way at the top. And then our second cervical vertebrae right below it is our axis. So we have our atlas and then our axis. And this is a pivot joint where the atlas sits on top of the axis and allows us to pivot our head to the left and to the right. Okay. Then we have a gliding joint. A gliding joint here is called a plane joint, but it's the gliding joint. And it allows things just to kind of glide on each other, just like it sounds, or two flat surfaces. So in our shoulder, we have our scapula that comes across. And if you follow your scapula all the way across and kind of move your shoulder around a little bit, you'll see where two, or you'll feel where two surfaces articulate or touch together. And right there, basically, that is a gliding joint. It's not supposed to rotate on anything. It's not supposed to spin around it. It just kind of glides up and down, and it shifts a little bit on that and allows shifting in different directions. But it's two flat surfaces that kind of butt up against each other. So there's only small shifting movements there. Then we have our condylar or ellipsoid joint down here. You'll find these in the fingers. And so with this, there's an oval shaped end. So we have an oval shaped end of a one bone. So that's this oval shaped end. And then that's going to butt up against a elliptical base or ellipsoid base, which is just like a flat depression. And that's going to allow some sort of flexion extension and maybe a little abduction, adduction. Remember, going out from the body and in towards the body again. Our wrist joints, which would be further up here, have some of that capability as well. So you find some of those ellipsoid or condylar joints up there. And then lastly, we have our saddle joints. And our saddle joints here, this is like a modified ellipsoid joint. So this is basically a little bit, there's a little bit more stability in that area, but it will still allow a little bit of movement. So there's two articulating surfaces here. One has a concave surface, one has a convex surface. So this one is going to be convex on this triquetral bone, and then here this is concave, like a cave that something goes into on the first metacarpal bone in the hand. All right. Now let's move on. Okay, so that is joint movements. Okay. Now let's look at just some common types of joints, or names of common joints, not types of joints, but names of common joints in the body. Okay, so this one here, this, if you look at it, gives you where all the common joints of the body are. So it's talking about the shoulder joint, the elbow joint, the wrist joint, the ankle joint, the knee joint, the elbow joint up here again. This is a costocartilage right here where the ribs come together with the cartilage and the sternum. And we have some shoulder joints here and right around the neck here too. And then this gets broken down on the sides here. And so it shows the elbow joint, shows that that's a hinge joint. The knee joint is also a hinge joint. Kind of shows how these joints work on the side, which we kind of went through already too. But this is an image. If you'd like me to share it, I could probably share this image on Canvas with you, or Canva with you, Canvas with you at some point too. Okay. All right. So, because not all of these are the same, if we classify these according to their movement or their limits of motion or anything, you'll see what they are as well. Most of these are synovial type joints if they are freely movable. So, like the shoulders, synovial or diarthrotic. Remember, freely movable. Our elbow is freely movable. Our knee is freely movable. Our ankle, anything that has that capsule, that joint capsule, and moves a lot. Um, and so most of these are going to be synovial joints in the body that you see here. Okay, now let's look at specific bones themselves. So not classifications anymore, not the ways they move anymore, but we're going to look at just the bones themselves, okay, and how they articulate with something else next to it. We're going to start with the face. And in the face, there are 14 bones. Now, you're going to have to remember this, either for one of our quizzes, maybe, or the MBLEX, but there are 14 bones in the face. And some of them are hard to see that there are two of them versus one of them. But typically, if there are two of them, they usually kind of butt up against each other. There are a couple where they are spread out a little bit from one side to the other, though. So we have, and there's a couple of them that are hard to see in the book as well. So this you might find in page 222, and most of these slides have a page number on them, so you can find those easily. I should have said that earlier in your Trail Guide to the Body book. So let's start here, and I'll give you a mnemonic to remember this as well. So the mnemonic here, and remember with the mnemonic, typically the first letter of each word in a mnemonic is the letter that corresponds with whatever terms you're trying to remember. Okay, so a mnemonic device for this would be my mandible chews 9 very large zucchini pizzas. My mandible chews 9 very large zucchini pizzas. So the letters here would be M, M, C, N, V, L, Z, P, which corresponds with my mandible chews 9 very large zucchini pizzas. M, M, C, N, V, L, Z, P. Okay, so what do those letters mean? We're going to start here with the maxilla. With the maxilla, there are actually two bones in the maxilla. It looks like one big bone, but there are two split down the middle. So the maxilla is the M, and that has two bones. Then we come down to the mandible. This is one bone. That's the part that goes up and down to help us chew. Um, then we have the conchae. The conchae you cannot see in this picture here, but that is going to be more inside, and it helps form the back of the hard palate and the roof of the mouth. That's the conchae. So actually, no, I take that back. The conchae forms the lateral walls. So it's not shown in the picture, but the lateral walls of the nasal cavity on either side. There's two conchae. There's one here, and sometimes they're called upper and lower conchae as well, or superior inferior conchae. But there's two of those, Conchae. Then we have our nasal bones. So there's one here, a long nasal bone, and one long nasal bone on the other side that butt up together to make it look like it's one. Okay, and then we have the vomer bone, and that is in the center, and it separates those nasal bones there. That is the vomer bone. There's only one. And then we have the lacrimal bones, and there are two of those, one here in red, one here in red, just the inner part or medial part of the orbital area. And we have the zygomatic for the Z. There's one over here, that's the cheekbone. One over here, cheekbone, that's zygomatic. So there's two of those as well. And that's your zucchini. And then for the pizza, the P, you have two palatine bones. And you can't see the palatine bones on this picture. We'll see maybe if we can see it on the next picture. This is the anterior view. But the palatine bones, yeah, F, where are we? We're going right there. So these are the ones I said, I mistook those for conchae early, but the palatine bones, that if you go on the roof of the mouth and go all the way back, forms the back part of the hard palate of the roof of the mouth. And there are two of those, one on either side, that butt up against each other. And they're kind of L-shaped. Okay. So 14 bones of the face. My mandible chews 9 very large zucchini pizzas is the acronym. Okay. Now, if we go to the cranium, okay, this is a lateral view, and you'll see a posterior view here in just a second, too. The cranium is basically what houses the brain, and there are 8 bones in the cranium. 8 bones in the cranium. So this one, there's a excuse me, mnemonic for this as well, and it is 8 octopus parts form the skull. 8 octopus parts form the skull. So 8, think 8 legs, and 8 octopus or occiput or osseous, which osseous membrane here. So 8 octopus parts form the skull. So that is E, O, P, F, T, S. E, O, P, F, T, S. All right. So the first one that you'll see is the ethmoid. So this is this one right here. F. This is going to be also part of the inner eye. Okay. Inner orbital area. There is one of those. So that really forms the roof of the nasal cavity. So it comes through here and forms the roof of the nasal cavity and the inner walls of the orbital bone. Okay. So that's the ethmoid bone. And there's only one of those. Okay. And then, and it's one of them that splays out to both sides. And then you have your occiput, A, right here. So the occiput is going to be the one in the back. So when you get hit in the back of the head, it gives you a big headache. That's the occiput there. Okay. Sometimes you get hit back there and then you feel it up here in the eyes. That's because your occipital lobe of the brain is right in back of that, or right in front of that, really. When that gets hit, it affects your vision. Okay, that's where your vision comes from, is from the back of the head. There's only one of those bones as well, one occiput. And then we have our parietal, B. So our parietal is right here, and there are two of those. They're fused in the center, so there are two of those. Our frontal bone, D, so it's in the front, frontal, front. There is one frontal bone, just like there is one occipital bone or occiput back here. There's one frontal bone in the front. And then we have our temporal bones, C. That is going to be the big one here, which is kind of like around the ear area and in back of the ear. So it's a big hard part here. Okay. That is our temporal bone. And there's two of those, one on either side of the body. And then we have our sphenoid bone, E. Okay. Our sphenoid bone is just in front of the frontal bone, just right up in this area here. There's two of those as well. This is a butterfly-shaped bone and back of the hard palate there, and it kind of splays to the side of the head too. Okay. Then, and then here's the back view here too. So if you're looking from the back, and I know you see teeth and everything, but that's like looking through the body from the inside of the mouth, looking out, actually. So you're seeing the back of the teeth and the hard palate here and everything. But you see the occiput right here. You'll see one parietal lobe here, one, or not a lobe, but one parietal bone, another parietal bone here. You see the temporal bone here too. That's part of the cranium. Then, and remember, 8 octopus parts form the skull, was the mnemonic for that. Okay, so we're going to move down the body now. So we started at the top of the body, we did the face, we did the cranium. Now we're going to keep scooting down the body, and we're going to go down the spine. Okay, so the vertebral column is separated into a few chunks. And so here we're just talking about the top part of the first chunk, And the first chunk is the cervical vertebrae. There are 7 cervical vertebrae. So 7, seven of these things. 1, 2, 3, 4, 5, 6, 7. The bottom one is typically the one that protrudes the most out of the back of the neck. So the first one is called the atlas. Okay, first one is called the atlas, and the atlas is basically it's something that kind of rotates around something else, and what it rotates around is the axis. Okay, so the axis is right. So here, this process here is what this atlas kind of rotates around a little bit. Okay, so that's the second one. Okay, so the atlas is C1, the atlas is C2. And when I say C in conjunction with a number, I mean cervical. And so all of these processes have either a C or a T or a L or an S attached to them. And that corresponds with being part of the cervical vertebrae, the thoracic vertebrae, the lumbar vertebrae, or the sacral vertebrae. And so C1 is the atlas, C2 is the axis, and then the rest of them don't have their own individual names. These are just 2 very important ones because they help us, our head turn back and forth. Okay. So then we go to C3 through C7, so this rest of this area here. These are, again, the cervical vertebrae. These are the most mobile and the most accessible bones in the whole vertebral column, because it's stuck out here in space, basically, and so we can touch it and move it a little bit more. And it has to be the most mobile because we have to see danger and we have to see where we're going all the time. And so these bones are a little bit smaller, and then they get bigger and bigger and bigger as they go down, because these are more stabilizing and for structural purposes down towards the lower part of our body, whereas these are more for movement up top. So C3 through C7 are the rest of the cervical vertebrae. So there's 7 total. Then we get to the thoracic vertebrae. So each one is named with a T in front of it for thoracic. And we have 12 of those that run down, and they get a little bit bigger as they go down towards the lumbar area. That is thoracic. So they're designed for minimal movement themselves. They do flex and they extend a little bit, and they have a little bit of rotation and lateral flexion potential, but they don't move that much. They really help to stabilize the thoracic area and protect the internal organs, like the heart and the lungs and everything. And our ribs also come off of these to form the rib cage. Then we have our lumbar vertebrae. So we're moving down. These are the largest of our vertebrae because they have to provide support for the whole upper half of the body. So they don't move much at all. All the things that they have protruding from them, they hit the other protruding parts of the vertebrae up and below. And so they just don't allow that much movement. But they're strong, they're thick, they have a lot of stability and support. And there are 5 of those, excuse me. So we had 7 cervical, 12 thoracic, 5 lumbar vertebrae, and now we go down into, we don't show it on the next couple slides, but we have the sacrum and the coccyx down here. The sacrum actually has 5 fused vertebrae. So when we're born, they are not fused together. They're 5 individual vertebrae. And then there is the coccyx, which has 4 fused vertebrae. So those, when we are born, are not fused. So there are 4 of them, but then they become fused over time. And oftentimes in women, the lowest one does not get fused. That's because women have to have children. It needs to move a little bit more. And men's do get fused. However, sometimes women's do get fused, or it's too sturdy and stable, and so it gets cracked during childbirth, and that's no fun. So if you look at the spine itself, they all have some sort of natural curve. and it's kind of like a spring or a shock, and it's to absorb the shock of our movement, our up and down movement, as we walk, as we run, as we jump, and do all those things too. And so, and this is looking forward this way, and this is looking backward this way towards the back of the body, front of the body, back of the body. So if it is looking forward to the front of the body and bending forward, they call that lordosis. So this is cervical lordosis. So the cervical area of the spine has a lordotic curve. It's lordosis. The thoracic area has a kyphosis or a kyphotic curve because it points towards the back of the body, or it curves that way. The lumbar area has a lordosis, once again, just like the cervical area. And then the sacral area and the coccyx also have a kyphotic curve. So it goes lordotic, kyphotic, so it can absorb that shock. And if you look a little further, this is an FYI. Some things just kind of line up a little bit. So our collarbone or our clavicle lines up here with C7, so cervical vertebrae 7. This is in a normal person. Doesn't mean you're abnormal or not normal if you don't have this, but most people, I should say. C7 lines up with the clavicle in the base of the neck. T2, or thoracic vertebrae 2, and the superior angle of the scapula. Superior angle, superior meaning above. That angle of the scap, if this is a big triangle, that top angle, lines up with T2. The bottom of that clavicle, or scapula, excuse me, the bottom of that scapula lines up with thoracic vertebrae 7, or T7, the inferior angle there. And then the bottom rib, T12, lines up with the bottom rib. Okay. And then the top of the hips, L4, is where that lines up with typically. So lumbar vertebrae 4, and the top of that iliac crest. That's where they line up. So you can actually feel these on people, and that's what palpate means. So if you explore the body and palpate or move your thumbs or your fingers around the body, you'll be able to feel these hard structures in these locations. So let's get to the rib cage. Now, the rib cage, there are 12 true ribs, and you don't see these all here right now. I don't have a good picture of the rib cage, but there are 12 pairs of ribs, excuse me. So there are 7 true ribs and 5 false ribs, is what they call them. So the true ribs, and there are a bunch of pairs kind of coming up and down, and this is coming towards the front of the body. This is the breastbone basically here. Oops, the sternum. So if you go back here too, you'll see these ribs coming around. So the top 7 would be considered true ribs coming off of this thoracic area. And because when they come around, these ribs are going to be connecting directly with the sternum via costal cartilage here. Okay, this is costal cartilage right here, but they're going to attach directly via their own individual costal cartilage. And then we have false ribs, which kind of attach a little bit more distally via costal cartilage. So indirectly to the sternum, they're going to attach via the cartilage. And the 11th and the 12th ribs, there are a couple ribs that would come down here that you can't see, are floating ribs. Okay. They all still provide safety and structure for the internal organs, though, every one of them. So the first part we'll look at here is just the sternum. The sternum has 3 different parts. The top part here is called the manubrium. And then the middle is called the body of the sternum. And then the smallest part down here is the xiphoid process. The manubrium also has a little notch up here that everyone here can feel. If you feel the base here, you'll feel this depression. This is a sternal notch, or a jugular notch, it's sometimes called too. But basically, if you kind of shrug your shoulders a little bit, you'll feel a little bit of those bones kind of cozying your finger into that area, and that notch gets a little deeper. That is this rib that's kind of rotating up and down on this notch here, actually. It's not a great picture of this. And then if you go below, you've got the body of the sternum. This is long and flat. And then the xiphoid process, which sometimes is called this floating xiphoid process. And this can be cracked or cracked off a little bit at times with a strong hit, but it doesn't provide a lot of support. Just kind of floats around in there a little bit. That's a xiphoid process. That's the most inferior aspect of the sternum, whereas the manubrium is the most superior aspect of that. Remember, inferior means lower, superior means closer to the head or higher. Okay. So with the xiphoid process, for most people, it's cartilaginous through a lot of life. So it's made of cartilage, basically. But it ossifies, it turns to bone completely late in life, around age 40. So if you're younger than 40, you probably have a cartilaginous xiphoid process. And if you're older than 40, you probably have a bony xiphoid process because it's converted over time. It's a cool FYI. Okay. And with some people, it articulates or touches the seventh rib as well, which is the lowest rib of the true ribs. Then we have the bones of the shoulder girdle. The shoulder girdle consists of the clavicle, and this is looking from the front of the body. That's why you see the breastbone here. You see the clavicle here, and this is a cutout, so they cut the ribs out so you can see the whole scapula. So the clavicle articulates right here with the scapula, which kind of comes around here. Okay. And that articulates right there. That was that one I was talking about where it had the gliding joint right there. It articulates right there. And then the humerus is also, so the upper arm is also part of that shoulder girdle. So those three bones, the clavicle, the humerus, and the scapula all form the shoulder girdle. So here is a picture of the scapula, and the acromion right here, acromion, is where the clavicle would come across and articulate or touch. And this is where they glide a little bit on each other. So clavicle comes across, touches that, and then the humerus would sit in this glenoid cavity right here and come down. That would be the humerus right there. Okay. And this is just a rear view of that. And we'll talk more about bony landmarks and protuberances and everything later with that. Here's a picture of the humerus. So the head of the humerus right here, this is what goes into that glenoid fossa to attach to the scapula. And here's the clavicle. The acromial end is where that articulates. So this part articulates right here with the scapula as well. So both the humerus and the clavicle articulate or go into the acromion end here somehow. All right, moving down, we've got our forearm. So the upper arm, this part here, our humerus, is really what's technically referred to as the arm. This is not referred to as the arm in any medical text or terminology. Just this is the arm, and then they call this the forearm. Okay. So the forearm consists of the radius and the ulna. The radius is on the thumb side. So if you run all the way down, it attaches to the thumb. So here, that's the thumb. The radius radiates around the ulna, or basically this part down here turns around the ulna. Okay, so the ulna kind of stays in place, and the radius is going to shift around the ulna, which stays in place. Okay, so we say the radius radiates, and it's on the thumb side, and then ulna's on the other side. That's that hard bone that sometimes when we do massage, we use that bone sometimes to massage an area. I don't like using that bone, but some people do. And then we get down to the carpal bones. The carpals are the bones of the wrist, and these are cuboid, so they're more like cubes. They're irregular a little bit. But there are 8 of those, and we have a mnemonic for those too. So remember, 8 carpal bones, okay? And the mnemonic would be some lovers try positions that they can't handle. So starting over here, we have S, L, T, P, T, T, C, H. Some lovers try positions that they can't handle. And those refer to S, scaphoid, L, lunate, T, triquetrum, some people say, P, pisiform, and this one gets really achy on a lot of therapists. It's like in this little area here. T, trapezium, T, trapezoid, C, capitate, and H, hamate. Scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, capitate, hamate. Now, there are some songs on YouTube that try to help you remember these things, but they always just use the full words. But if you're musically inclined, sometimes just putting music to the words helps you remember them too. So you can check that out on YouTube too. There's a whole bunch of versions. So 8 carpals, some lovers try positions that they can't handle is the mnemonic. And then in the hand, you'll see there are 5 metacarpals. So we have the carpals that we just looked at here. And then if you go down below them into the rest, so into like the palm of the hand, back of the hand here. If you go down here, you will find the bones that start coming off of those wrist bones. And there are 5 of those. And so those are the metacarpals. So we have the carpals. Now we have the meta, like Facebook, carpals. And there are 5 of those because there's going to be 5 phalanges. And then we have the phalanges that come off of those. And there are 14 phalanges. In each one of the fingers, there are 3. So there are 3 sections in each one of these. And then on the thumb, there's only 2 sections. Okay. So all of that put together means 14 phalanges. Now, interesting thing is the phalanges, the fingers here, they contain absolutely no muscles. And so all it is skin, fat, and tendons and ligaments, basically, that are in here. And when we pull those tendons, the flexor tendons, it flexes the fingers. And when we pull the extensor tendons, they extend the fingers and the thumb as well. Okay, so no muscles in there. It's probably on a Trivial Pursuit question or something, but there you go. So that shows the bones of the forearm again. So the radius, the ulna, then the 8 carpals. And then we go down into the metacarpals, which are more in the base of the hand here, the palm. And then the phalanges, the fingers that comes off of there. Okay. Then we move further down and we're going to hit the pelvis and the pelvic girdle. So the pelvic girdle, or the pelvis, basically, contains the hip bone, and the hip bone is divided into 3 parts, and that is the ilium, the pubis, and the ischium. And looking from the front, you'll see the big elephant ear here. That's the ilium part of it. And then the pubis is the part of the bone that comes down to the pubic symphysis here, which is the cartilage here I talked about earlier. And then if you look at the back of the body, where the hamstring attaches in the back of the body is the ischium, and more specifically the ischial tuberosity, but the ischium is in the back. That's what the bony part that we sit down on. Okay, so the ilium, the pubis in the front, and the ischium in the back forms that hip. And then the sacrum and the coccyx would be considered part of this, and the femur as well. All forms the pelvic girdle here. Here's a side view. So you see the big ilium here. This is the fossa where the hip sits, or that's the hip bone, basically. That's where the femur comes up and sits in the acetabulum. Okay. The ischium which is that part. And this part here is what we sit down on, and it's bony sometimes on a hard surface and gets kind of numb. And then the pubis, or the pubic bone here, comes up this way in the front here. Okay. And here's just another view, and you can see the sacrum as it is fused, and the coccyx as it is somewhat fused down here too. And each one of these little ridges would be separated at birth. Okay, that's the sacrum and the coccyx too. Okay, here's another picture of the femur as we move down the body. So the head of the femur is what sits into that hip socket, and it rotates around. It is a synovial or diarthrotic joint. It has free motion, most movable joint in the body, and it has synovial fluid within a synovial capsule to help keep it lubricated to move really easily. And then we move down the leg, and we have two little parts at the end, two bumps here, and these are called condyles at the end of this femur. And you can't see it here on this slide, but the patella or kneecap is going to sit right here. And in the back of the patella, you'll see here in a second, has a couple depressions where these parts of the femur down at the bottom sit in there and kind of glide around it. And this is just a posterior view of it. So here's the patella. It has an apex, and the apex is actually at the bottom of the patella. The base of the patella is at the top, and this is a front view. And in the rear view on the upper right here, you see these two facets. And so these are just more depressions here that the two parts, those two bumps on the end of the femur, can sit in and rotate around a little bit. And here's another picture of everything kind of put together. So you have your big tibia down here, bottom part of the leg. But here's the patella and the femur coming down off of the upper leg here, where your quads are. And these have two little depressions in the back. So it hits these two bumps here and glides on that. Okay. And then we're going to go down a little bit lower, and then you'll be able to see the tibia and the fibula. So the tibia has two surfaces here that articulate too. And so this is more depressions on the tibia that these concave or convex surfaces of the femur go into. And they can glide a little bit more on the tibia. The fibula itself does not touch um, the femur. It only touches the tibia here. So fibula articulates with the tibia. And here you can kind of see those two bones. And so we have the big tibia. This is actually the weight-bearing bone of the lower body. Okay. The fibula doesn't bear the weight. It attaches to the side of the tibia here, and then it forms our ankle bone, like the outside aspect of our ankle. So sometimes we get that run into by a cart or something. That's what it's hitting, is that end of the fibula down here, and that really hurts. Okay, so tibia is the big, thick, weight-bearing bone which articulates or touches the femur, and the fibula comes off of the side of that tibia. And then here's another closer view of those two things. So the tibia, the fibula on the side of it, and this is the back view of it, the fibula on the side of the tibia, and then this is coming down, forming the side, one side of the ankle, and this is forming the other side of the ankle, protecting a couple little bones that are inside here. All right, and then you go down to the bones of the feet. Now, if we remember the hands we had carpals forming the wrist bones, and then we had metacarpals forming all the bones in the hand here, and then we had phalanges at the end. So we had carpals, metacarpals, phalanges. Now in here we have tarsals, metatarsals, and phalanges. So the tarsals would be what the carpals are to the hand. The metatarsals would be what the metacarpals are to the hand, and the phalanges would be what the phalanges are to the upper body. So again, we have three parts to those phalanges here, two parts to that toe there. That's kind of like the thumb of the foot, basically. Okay. And then here is a bottom view of all those two, and so you'll see the you'll see all these tarsals, and then you'll see the metatarsals, 5 of those, and then you'll see the phalanges here, the 14 phalanges. And there's 2 little bones here called the sesamoid bones that can kind of get irritated over time too. They're tiny little bones, but those have to be there. They're enveloped in a tendon, and they're synovial joints. And when we flex our toe or extend our toe, more when we extend than even flex, it helps those tendons not get irritated as they kind of bend around that area over and over. Okay. And then a side view as well of the foot. And so you can kind of see where the tibia and fibula would come down. But this is what's housed inside that bottom area of the tibia and fibula. And we see the arch from the side. It's a little less arch looking from the outside as it is from the inside. So when we have a lot of pressure with that tibia that's coming down more on this medial aspect, it presses the foot down as we walk and run and jump. And so this plantar fascia that runs along here gets a little irritated as these bones push down on it all the time. And sometimes right at the hook here of the calcaneus is where it gets the most irritated. And we'll show you how to treat that later too. Okay. All right, guys. Thank you so much for listening. This was our Kin 102 lesson, Kinesiology 102. More to come later. All right. Thanks so much.